parents want to know how and when epilepsy is diagnosed. When would you make that diagnosis?
So typically we would make the diagnosis of epilepsy after a child has had a seizure. And then we performed an evaluation to determine whether there's actually a chronic risk for that seizure to recur, and where we kind of do a history and delve into the seizure, the behavior that potentially occurred, and try to determine whether we think that this was a seizure or not. And then if our index of suspicion for that is high, then we then will proceed with a test called an electroencephalogram, also known as an EEG, which really looks at the brain electricity, and allows us to look for abnormal activity that would say that they're at higher risk for seizures to potentially recur. And if that test comes back abnormal and they've had a event that would be consistent with a seizure, we would then potentially make them with a diagnosis of epilepsy at that time. And that just means that you're someone who has a chronic risk or a chronic predisposition for having seizures in the future.
A lot of times seizures are co-occurring with other conditions. Can you explain more about that?
Yeah, so there's definitely several comorbidities that we will definitely see within epilepsy. Um, you know, that being said, the majority of children who have epilepsy, we probably should start with, are developmentally normal, have normal intellect, and they're normal in every way, shape, or form, except for the fact that they have epilepsy. That being said, there are some of these other comorbidities that occur more frequently, specifically attention deficit disorder, hyperactivity disorder, so ADHD. Certainly, there is a higher rate of learning disabilities. For about both of those, it's somewhere between the order of like 10 to 20% higher risk of learning disabilities or ADHD. Um, Certainly, we see that in our autism population, there's a higher rate of epilepsy that occurs. So again, about almost 10 to 20% of kids with autism also have epilepsy. So that's not an uncommon crossover between the two, since both of those things occur relatively commonly in the general population. A lot of what we're doing whenever we're assessing our kids is not only assessing for seizures, but also assessing their learning capacity, their development, and screening for these things that they're potentially at risk for. Oftentimes, neuropsychological testing is a really useful tool that we'll use for many of our patients with epilepsy to kind of screen for these types of things. Certainly in working in combination with the school as well.
I think parents want to know, does the seizure hurt the child? Is it causing damage?
What's occurring during a seizure is that you have a bunch of nerve cells that are firing electrically all at one time, and then depending upon where that electrical firing is occurring at and the function of the brain in that specific area, you can get different types of behaviors that can kind of occur with that. In general, it's felt that in most individuals, most single isolated seizures are not harmful, um, as long as they're not particularly prolonged. So we know that seizures, and particularly we know this from looking at like animal models of seizures, that seizures that are prolonged, seizures that last 30 minutes can absolutely potentially cause some degree of injury to the brain. We also know that in children who have poorly controlled seizures, that if you look at the cumulative effect of that over time, those kids do not seem to do as well overall academically. Their cognitive performance doesn't seem to be quite as good. And you can see the longer the difficult to control seizures last, the more difficult and more struggles they oftentimes will have. That could be a combination of either the seizures causing just underlying problems over time and in potential injury to the brain and having an impact on its function, but also the compounded effect of numerous seizure medications and being on 2, 3, 4 medications sometimes can all kind of compound that in terms of side effects that also can kind of have an impact on those types of things. So that's why we do have a tendency to be very aggressive. And whenever we identify patients who have very difficult to control seizures, to try to be aggressive with our therapies, to try to get seizures under control, to really keep epilepsy surgery for those folks who are candidates, which may oftentimes be the only curative option for seizures, and in the forefront, and trying to do that sooner rather than later, because ultimately those are the types of interventions that oftentimes can have a real positive impact on long-term outcomes in terms of specifically as it relates to cognition and overall function.
What should parents ask regarding medications?
Yeah, the first thing to recognize up front is that unfortunately there are no perfect anti-seizure medications. So they all have some potential side effects. So if you go and pull the potential side effects of every medication, you'll find that there are hundreds of them listed there. The reality of it is, though, in most circumstances, um, we can find a seizure medication that works well for most individuals and we're able to get them to tolerate that medication without side effects. And so that being said, it's important as you're talking about the options with your doctors about what medications you may want to try, that side effects and the possibility of various side effects is discussed with each of those medications, taking into consideration the side effect profile, again, the types of seizures they have, as well as like even the formulation. How does it actually come in terms of pills or syrup or dissolving films or tablets, the chewable tablets? There's this a whole different, multiple different ways these preparations come that you kind of take into consideration as well. And in most circumstances, the doctors that you're dealing with are going to outline those for you about the really high risk things, the things that we see every day in practice, the things that we have to kind of worry about. But in general, like I said, we usually can find a medication that we can find for most individuals that can keep the seizures away and then also tolerate well, and that's our goal.
How do you develop with a family a seizure plan?
Really the goal or the main thing that a parent or anybody taking care of someone who's having a seizure needs to do is kind of keep them safe. The reality of it is that in general, once the seizure is over, the emergency is over. Seizures in general last 1 to 2 minutes in most individuals, and so they really don't have to do a whole lot besides just keep them safe. So usually we recommend that we would have them roll them onto the side, loosen any restrictive clothing, make sure they're not hitting their head off anything or anything that's potentially going to be injurious. Don't stick anything into their mouths. Sometimes people talk about, oh, we're worried about them biting their tongue or swallowing on their tongue. No one swallows their tongue. That's an old wives' tale. And so, but certainly people may bite their tongue, but you're much more likely to injure them or injure yourself by trying to put something in there. So just roll them onto their side, and then that way that keeps their airway open in case they were to have any episode of vomiting or anything during the seizure, and it keeps that airway open. And then certainly the most important thing is to look at your watch, so that way you know how long these are lasting. Even for trained professionals who look at videos of seizures of folks having seizures all the time, whenever we see one, they always seem like they last longer than they actually are. So knowing how long it's lasting, timing it, and then knowing that, like I said, the majority of people, seizures are going to last 1 to 2 minutes. So if you start having it occur and it's now exceeding that 5 minute mark, the likelihood once you hit that 5 minute mark of that seizure starting to stop on its own without some form of medical intervention statistically starts to go down. And so then that's a circumstance then if there are medical rescue medicines available that we would use those in those circumstances. And also activate 911, particularly if there's no response to the rescue medication that they have. And in most circumstances, that medication will work without any further interventions needing to be done. Oftentimes, children following a seizures will be sleepy or tired. Certainly, these medications also will compound that. So again, kind of keeping them safe, making sure they're kind of in that rescue position. But usually they'll start to wake up, start to swat at you a little bit in terms of being able to engage in some form or fashion. And so shortly after the seizure is over. If they are not starting to respond, then it's always reasonable to reach out for assistance through EMS and come and have someone assess them and see how things are going.
Is there something that a parent can do to lessen the likelihood of a seizure?
Yeah, so the main things, there are several things that we could think about here. One is just compliance, taking your seizure medication as being directed by your doctor. Certainly missed doses is by far one of the most common reasons for breakthrough seizures. So that certainly is probably the number one reason for why we see that. Number two would be sleep deprivation. So something we know that epilepsy and sleep are very closely tied together, and having a sleep deficit absolutely can make the brain hyperexcitable and make it more likely for you to have seizures, specifically for certain epilepsy syndromes. So there are certain syndromes that are really higher likelihood for that to kind of happen. Number three would be illnesses. So any type of illness lowers your seizure threshold and makes it more likely for potentially for seizures to potentially occur. And then lastly would be medication. So if there are new medications that you're starting, it's always a good practice to ask the pharmacist, does this medication lower seizure threshold? Does it make it more likely for me to have a seizure if I'm someone who's at higher risk? And with that, there are a number of medications that can do it. So usually I don't list every potential medication out there because there's so many of them, but it's a good practice to just ask your pharmacist. And that also goes for over-the-counter things as well as even herbal supplements. So just keeping in mind that those types of things sometimes can cause interactions or they can cause problems that set you up for risk of seizures.
Is there something that you really feel that parents should know?
I think probably the big thing from my perspective is remaining optimistic. Yes, the epilepsy, particularly for folks that are experiencing it for the first time, is extraordinarily scary for many families. But the good news is that we have good therapies that, in most individuals, we're able to get seizures under control, and are oftentimes tolerated well. And in those circumstances where the medications aren't working, there are more and more alternatives becoming available. So it's just really important that if you do find yourself in that subset of population of patients with epilepsy, which is about 20 to 30%, that just have very difficult to control seizures, that they are, being seen by neurologists. They are being seen by those centers that have expertise in the management of epilepsy and really making sure that they've heard about what all the options are for their potential treatments.